Good afternoon, everyone. Thank you for attending the first in our exciting new Empowering webinar series. In today's session, we'll be covering RX tips and tricks. My name is Micah, and I am the Senior EMR Technician and Interface Department Manager for Complete Healthcare Solutions. I know I've worked with a lot of you regarding your interfaces, upgrades, and other questions, but today I have the privilege of being your conference moderator. For those that don't know, CHS is an award-winning McKesson EMD's business partner, providing service and support nationwide to LytecMD, Medisoft Clinical, and Practice Partner. You've probably had most of your communication with Kathy Denner, one of our administrators, and you can continue to do so to find out more information about upcoming free sessions, or if you have any additional questions, she will connect you with the correct consultant. We're excited to announce that our next session will be covering templates, dot codes, quick text pick lists, push codes, and enter codes. All lines have been placed on mute to prevent any background noises. At the end of the session, the phones will be opened up for you to ask questions. Press star 6 on your phone to unmute your line. Once your question has been addressed, please place your line back on mute by pressing star 6 again. If we run out of time or you're not comfortable asking your question on the phone, you can reply to your conference session invite or send an email to kdenner@mailchs.com. That's KDENNER@mailchs.com. And we will post the answers to all questions anonymously on our chsalerts.com website under Training Resources. I will now turn the call over to our LyTech and LytecMD optimization consultant, Amanda Sawicki. She's one of our premier consultants that waves her magic wand over this product to reduce the pain of everyday use. Over the years, she's helped countless independent practices streamline their workflows to enhance patient care. Take it away, Amanda.
Thank you, Micah. And good afternoon, everyone. And thank you again for joining me today for our first session of our Empowering webinar series on RX tips and tricks. Today, we will focus on RX templates, extended SIGs, and RX fill history. Day in and day out, we are presented with the same daunting tasks that eat up too much time. In the medical field, one of the tasks that eats up too much of this time is writing prescriptions. Wouldn't it be great if they could just write themselves? Well, when using medication templates, they almost do. Using medication templates help you provide more efficient patient care. You will spend less time searching for common medications and less time typing. Let's take a look in a patient's chart. Within the RX screen within a patient's chart, we're going to click on the New button in the lower left corner. Once the prescription screen opens, you can use the Lookup button to search for already created RX templates. We're going to pretend that in this scenario, no medication templates were found. So we're going to populate all of the medication information as you normally would. But before you click on OK to print or transmit, select the checkbox on the lower half of the screen that says New RX Template. Then click OK. The screen for naming the RX template will appear. Enter in the template code, a shortened version of the medication name and size. Then, in the template name, you can provide further details such as the medication name, strength, and directions. After populating this information, depending on the submission option that you have selected, the system will either take you back to the medication list or start the process of sending or printing the script. If we click on New again to bring up the prescription screen, we can now use the Lookup button to find the template that we just created. It will populate all the data that is entered into the template. At this time, you can make any changes that are needed or click OK to prescribe as is. Creating prescription templates can also be done from the maintenance menu. click on Maintenance in the toolbar, then Templates, then Prescription Templates, and Prescription Templates. From here, you can create new templates, modify existing ones, or remove ones that are not applicable to the practice. We're going to click on New to create a new prescription template. This screen should look familiar as it mimics what you see when you are in a patient's chart. The only thing that is going to be different is the top of the screen where you see the RX template code and RX template name. Go ahead and populate this information. Next, you will enter the prescription detail information as you normally would. Lastly, you will select any additional options using the checkboxes. If you wish to have an extended SIG automatically applied to a template when using within a patient's chart, either check the Use Extended SIG or Use Extended SIG Only box. Since extended SIG templates are not entered in on the prescription template screen, make sure you write down or remember exactly what the RX template code is, as this will be needed when creating the extended SIG. Once completed filling out the information, click OK. Now we are going to create the extended SIG templates by going to Maintenance, Templates, Prescription Templates, and Extended SIG Templates. From here, you can create new extended SIGs, edit existing ones, as well as remove ones that are not applicable. If you are editing an extended SIG template, enter in the RX template code and then click on Search. In this case, we are going to create a new one, so we will click on New. On the code line, enter in the RX template code. This must match exactly. In the name field, you can enter in any information you want. This does not have to match the RX template name. In the field for the description, enter in the extended SIG information. Once all the data is entered, click OK. This will return us to the list of extended SIGs, and we will go ahead and close out and bring up the prescription screen again within a patient's chart. We're going to enter in the RX template code and then click on Lookup. It will find the prescription template and the extended SIG template that have the same exact RX template code and pull them together. Once the information is pulled in, you may make any changes that you feel are needed, or click OK to prescribe as is. RX fill history is a great way to load medications into a patient's chart if they are unsure of what medications they are taking or if they are on a large number of medications. Not only is this a quick method, but it also ensures accuracy and patient safety. When we're in the medication screen in a patient's chart, there's a tab at the top that says RX fill history. If we select this, this will bring us to the fill history selection. If a fill history was never done previously for a patient, it will say no fill history is available on this patient. Down at the bottom of the screen, click on the Update Fill History. This process may take a few minutes, but the great thing is you can close out of this tab and start the other processes of the intake while it is running. Once the data comes back into the system, the list of medications the patient has been prescribed over the past 21 months will be pulled into the system. It will be organized based off of the last fill date. Verify with the patient that this is the medication that they are taking and select Add to Current Meds. The new RX screen will appear. In order to save, the user must correct the RX line, as you will notice that it populates not only the medication name, but the size and the form as well. You can add in any of the other detailed information that you feel is necessary, although it is not required. Once you are done, click on OK at the bottom. The medication that we just added will now appear under the Current tab on the patient's medication list. This completes our demonstration for today. I would like to thank everyone again for joining us in our first session in our Empowering webinar series, and to please stay tuned for our next upcoming session. I will now turn the call over to Micah.
Thank you, Amanda. What great information. Just as a reminder, you can send your email questions to kdenner@mailchs.com or reply to your webinar invite. Any questions will be posted with their answers on chsalerts.com under Training Resources in the coming days. This concludes today's session, and again, I'd like to thank you for joining. You can give us a call at 1-800-250-8687, extension 110, or email kdenner@mailchs.com. Watch your email for upcoming free sessions. Thanks again, and enjoy the rest of your day.